Hey everybody, welcome to another exciting edition of Living at Your Highest Quality of Life with the doctors at Inspire Wellness. Hopefully you remember me. I'm Dr. Dan Nitis, and Dr. Jessica is off today. So we wanted to spend some time with a very special guest. We have Dr. Matthew Kogan, or Matt Kogan, here with us, and he has a very impressive resume, folks. You're going to want to listen to him. You're going to want to listen to what he has to say very carefully and very closely, because what we are seeing in the functional medicine practices, that people are dealing with heavy metal toxicities, which are contributing to significant illness. And it's not just about being symptom driven, but known diagnoses. And so in our world, in functional medicine, we try to figure out root cause for you. We look for things like inflammation, deficiencies, nutrient deficiencies, and then if there's challenges detoxifying, try to help and assist your body to do so. And when we look for disruptors in the body, it is unbelievably common to find heavy metals, mercury specifically being at the top of that list. So we brought in Dr. Kogan to talk about why silver amalgams can be contributing to disease and the proper way to not only get the body ready for extraction, but the proper way to do the extraction. So I'm going to stop talking and turn it over to you, Dr. Kogan. And thank you so much for being here today.
Thanks for having me. So today we're going to talk about, like you said, silver fillings. And a lot of people know the term silver filling, but it's a little bit misleading because generally we name things based on the majority of the constituent that's within the material. So with a silver filling, 45 to 55% of that filling is in fact mercury, elemental mercury. And a lot of people don't know that. So it's more accurately described as a mercury filling. But because it looks silver, people refer to them as silver fillings. Now, a lot of people out there think, I've had silver fillings since I was a kid. It's really no risk to my body. They've been there forever. What can go wrong? Well, the truth is there is a mercury vapor release from these fillings throughout time, because so much of that filling is mercury. That vapor release will increase when it's agitated, when it's heated.
Okay.
So if you brush that filling, you will have an increased exposure to mercury vapor in your mouth. If you grind your teeth, you will have an increase in mercury vapor. So there are a lot of risks that come within the filling itself that people don't know about. So I think a good starting point is to realize that the majority of that filling is mercury, and it needs to be dealt with as mercury. Another thing people don't know is that mercury is the most toxic, non-radioactive element on the planet. So we need to handle this material that way. And currently, in the dental world, the American Dental Association and the FDA, they fully support the use of mercury amalgam fillings. They have deemed them to be safe and effective. But with that, there's always an opposing side.
Right.
And the scientific literature is out there that shows that there could be risks when this is not handled correctly.
So one of the concerning things that we see, again, when we're seeing patients and evaluating them, is the common themes when we do ultimately find out that mercury toxicity is contributing to their ill health. Things like brain fog, excessive fatigue, movement disorders. So benign essential tremor, where people shake their head a little bit or their hand, and they see a neurologist and they're told, oh, don't worry about it, it's benign, it's not Parkinson's, but it's not so benign. And then things like Parkinson's, so movement disorders, gastrointestinal disorders, skin issues. I mean, it is amazing how much is really related to this metal. And I think that it really and truly is being ignored by the most, I think, dentistry. The reason that I say that is I always ask patients if they have silver fillings, or we'll call mercury fillings, or if they've had them removed, and then I ask them the techniques that have been used, and it's almost 100%. It was just my regular dentist. He drilled it out, he took it out, and he put a white amalgam in, and then, but no protection. I asked, did he wear a mask? Were there dental dams used? And it's like, no, it was really easy. He popped it, drilled it, popped it out. And again, I think that we really want to educate the public on why you think very differently, and then what is actually your approach when the patient's in the chair to protect them. That's
right, so it's a big question, and I'm going to answer it piece by piece. The first thing is that we have to realize that mercury in itself is the only heavy metal that is a liquid at room temperature. So mercury, when it's heated, becomes very dangerous, and it becomes dangerous at the respiratory lining. So when you inhale very small particles or particulate matter of mercury at the lungs, it will redistribute to the rest of the body.
Wow.
And just like you said, if it gets trapped in the central nervous system, it becomes very difficult for you as the physician to get that out,
right,
because it can stay there for decades. So when you remove this, the dentist is going to use a high-speed handpiece, and they're going to drill on that filling. And that is going to generate an intense amount of mercury exposure to the patient, to the dentist, to the assistant, and to everyone else in the office. And this can be measured very easily with a mercury analyzer. So, the naysayers can get one and just see for themselves.
Right.
So to get to the protocol, you're right. There is no right or wrong way, quote unquote, as the masses would say, to handle a mercury amalgam filling. You can drill it out, and that is okay. However, if you want to be cautious, there is a very strict protocol that can be followed. And this protocol comes from, it's called the SMART protocol. It's a safe mercury amalgam removal technique. It was developed by an organization called the IAOMT, the International Academy of Oral Medicine and Toxicology. And it's a scientific standard that's trying to reduce the amount of particulate matter from mercury, not only to the patient, but to the dentist, to the assistant, and to everyone else in the office, because it's dangerous to everyone in that room. And I'll walk you through that protocol a little bit. But essentially, that protocol requires a few things. One, if you're having complicated systemic health issues, you need a physician to really make sure that you are prepared to undergo the removal of your amalgam fillings.
Okay.
As good as we say we are, we're dealing with something that's very toxic, and we can't say that there's zero exposure, but we really try to minimize it.
And then can anybody do that for you, or do you try to partner with functional medicine?
You really need a functional medicine physician to recognize that, in my experience, to even admit that there could be a problem with heavy metals.
Right.
And mercury is synergistic with other metals. So while there's only 45 to 55% mercury, there's copper, tin, there's some zinc and silver. And these can act together, right, to make things worse.
I didn't see. I learned something new today. Great.
So in my practice, the protocol essentially, after we do a thorough examination, make sure that we're ready to do the procedure, it begins by draping the patient head to toe, no skin exposure, personal belongings aren't exposed. People have to understand that mercury, even on your clothes, if it's not cleaned up properly, it will stay on those clothes. It can be absorbed in the skin.
Wow.
So we treat it just like that. So the person will be draped head to toe. Beforehand, they will have a slurry of chlorella, which is a good binder if anything penetrates the physical barrier where we're going to be removing the amalgam. And then we'll kind of begin the setup. And for the setup, we're going to place a rubber dam, which is going to isolate that tooth. So when we're drilling out, we have a barrier between the mercury vapor and the patient's throat. We want to avoid that vapor going down into their throat, dispersing to their body. And if it does pass through, we have the chlorella to try to bind to it before it's absorbed. Once we isolate, we have air purification, 2 inches from the patient's mouth, that is specifically intended for dental mercury amalgam. So we have that in place. And then, of course, the dentist and the staff that we will gear up. We have mercury masks they would use in a school for a thermometer spill.
Wow.
To go clean out that building so we don't breathe in the mercury. And we will wear hazmat suits graded for mercury amalgam. So we don't get it on us as well. We also apply a cream that's called HGX cream. And again, this is used in mercury spills. It has an affinity to bind mercury. So we will lather that all over the rubber dam. We want to trap anything from going into that patient's mouth onto the surface of that rubber dam or into the air purification.
Wow.
After we've all set up, we're all sealed head to toe, hair covered, legs covered, purses, wallets, cell phones covered. We're essentially ready to begin removing the amalgam. And it even includes covering the equipment in the operatory because, this is a hot spot,
right,
for mercury contamination. When we remove the amalgam, we have a specific technique in which we do it. So we don't want to cut into that filling as much as we can. Every time you drill into it, you're going to have a release of particulate mercury vapor.
Right.
So we want to use a specific burr to cut, and we want to take that out in as many chunks as we can, in solid pieces, to minimize the amount of vapor exposed. Once all of the metal is taken out of that tooth, an important part I missed is the patient is breathing medical grade oxygen the whole time.
Wow.
So they have to be breathing fresh air because we don't want them breathing contaminated air.
Sure.
So once the amalgam's out, we keep the patient on oxygen, and we essentially do a clean sweep of the room. We go through that room just like a mercury spill. We clean it up with specific cleaners for mercury. We take all the instruments out of the room, and we essentially reset up the room. And when we're all done, we come back in and we resume normal activity.
Okay.
We followed up with chlorella.
Right.
And there are different protocols that can be done with supplementation with a physician to help them,
right,
detoxify from amalgam.
Well, that is amazing because that is a very different experience than what I hear from the majority of patients that are having this done. And I feel relieved that you're protecting your body, your staff, your patient, to make sure that they are going to have the best possible outcome. And I know that there are plenty of naysayers. They say that this is too much and you're going overboard. I would say that I see the downstream effects of mercury toxicity to tell you folks that this is the way to do it. If you are going to consider this type of an extraction, please talk to Dr. Matt Kogan, his staff. If he needs to refer you out because he's busy, he can find another dentist in the area that would be able to help you that does it the exact same way. But please do not be penny wise and pound foolish when it comes to your health. You're talking about a metal that should not be in the human body. And when it does get there, it can cause serious, serious disruptions. It's fascinating listening to this. At 52, I have still not had a cavity. And so I don't even know what the procedure is to actually have a tooth drilled, thankfully. Thank you to my parents for the good genetics. But seriously, I think that for people who are considering having the switch from the mercury amalgam to the white amalgams, Dr. Kogan is at least someone to talk to before you make your final decision to proceed with him or another dentist. You want to make sure that you are ultimately protected from any type of a toxic exposure moving forward.
It's interesting. You bring up a good point. The World Health Organization in 2005 released a report saying that there was no level of mercury at which no adverse health effects occurred. And
so no safe level.
There's no safe level.
Right.
And so we think, and here's another interesting point that I think we should point out. The EPA requires by law that in a dental office, when we take out any mercury amalgam, we have to have a trap at the end of our office before that sludge goes into the water to separate the mercury out of the water supply so we don't pollute the environment. Yet there's no restriction on that mercury going into your throat. So by law, we do have to protect it from going into the water, but into your throat, no big deal. That's absolutely okay.
That is just frightening.
Yeah.
It really is.
Yeah.
So I know we're up against it at quarter of the hour. Could you please give your contact information to our audience so that they can contact you directly for further evaluation?
Sure. So I'll say this. A great place to start is with the IAOMT. And in your area, you can find a dentist that is SMART certified who should follow these stringent protocols. My personal contact information, my office phone number is 440-646-1133. You can email at Kogan, Kogan, DMD @gmail.com. We do have a website. It's a little under construction, but it's KOGANDMD.com, and then we'll have all of our contact information. So you can check us out there, and we'll have a full site up soon.
Awesome. Matt and his dad are partners. They are absolute rock stars in the dental world. You do want to meet with them if you are considering this type of work on your mouth. So please, please, please do not cut corners. We're so thankful that you took the time to come over and educate our patients. If there's anything that we can do to help your patients, you know that we're here for you as well. And I'm telling you folks, you got the dynamic duo here. No, you have Dr. Kogan, who is just at the top of his game. And again, so appreciative of you taking the time to educate us.
Well, thanks for having me. And again, I can't stress on our end how important it is to have a physician on board like you, because if you want to get the results that you're really looking for, it's going to be very difficult to find in the traditional allopathic world. Wow. So we need people like you to help us out and help patients achieve true health.
Totally appreciate that. Remember, it is your time to thrive. Let us inspire you. We will be back with you next Tuesday, the 22nd. And thank you so much for participating and sending us the ideas for topics that you want to learn about. Till next time, have a great week. Gotta have the music.
Gotta have the music.
Bye, everybody. Thanks for the love.